A very good evening, everyone. Today, we have Vaishali Ray, a theatre and a voiceover artist, an actor and event host. She will be the anchor for this program, asking the right questions on your behalf to the health experts. Let's welcome Vaishali Ray, anchor Wellness Wednesdays.
Very good evening, everyone. Namaste and Mabuhay. Welcome to another episode of Wellness Wednesday. IB, a not-for-profit organization, provides a platform dedicated to women in enterprise in the Philippines. It aims to empower their entrepreneurial and professional spirit to its highest potential. For one to achieve their full potential, health is important. As part of India-Philippines Friendship Initiative, IB brings to you Wellness Wednesday episodes. In our mission of creating health awareness, every month we will bring you a well-known medical expert with a brand new topics that will be relevant to us. All you have to do is ask the right questions in the comment section, and we will get the expert to answer them. Our first episode on COVID-19 lessons was well received with over 250 views. And for those of you who have missed the session, it is now available on our YouTube channel, the link of which is below. Today, we bring to you another topic of relevance, healthy heart. Health is wealth. We all know that. But do we prioritize it? We know the right things, but do we follow them? So join me today for an hour with Dr. Anuj Clerk as we speak about the various aspects of heart diseases and its management. Find out the right ways to keep that precious heart of yours beating well. Dr. Anuj Clerk is a critical care specialist. He is head of intensive care services at Sunshine Global Hospital at Surat, Gujarat. He has been dedicated to critical care for 22 years and has over 36 publications in journals and has written chapters in API textbooks of medicine and annual critical care updates. He has also given over 200 lectures in conferences and seminars. He is founder of the Arrest Outcome Consortium, which is an online CPR registry. He has conducted over 260 workshops on cardiopulmonary resuscitation or CPR. For over 9 years, he has been working on error prevention modules and has been conducting workshops for doctors. We are honored to have such an eminent and passionate guest speaker with us today. So let us now welcome Dr. Anuj. Dr. Anuj, hearty welcome to IV's Wellness Wednesday. Firstly, thank you for agreeing to share your knowledge on something that you're so passionate about.
Thank you.
The right knowledge is very critical. It is only when an untoward incident happens do we think, oh, what do I do now? Or I wish I had known. I personally feel that if this session can influence even one person to take the right decision at a critical moment, I feel we've done a good job. Right, Dr. Anuj?
Yes, that is. In fact, we need more and more of such sessions to enlighten people, because I would like to start with a very basic norm that the very meaning of doctor is to teach. Doctor means they are teacher of medicine. So it is not just, it is now misunderstood that doctor keep on prescribing and patients follow, those who follow will benefit from it. But yes, doctors should be teachers.
That is so lovely. Dr. Anuj, you have been selflessly conducting CPR workshops across India, and you have conducted more than 250 workshops. You are someone with many feathers in your hat. I did tell our audience that you are the founder of AOC Registry. Can you please tell us a little about what it is?
Say, as we are aware that developed countries have really made decent advances in their medical field in terms of research, but developing countries are yet to catch up from it. And as you know that India is I would say, the biggest exporter of a trained manpower across the world. But India per se as a country, do not have their good database as far as cardiac arrest is concerned. So we, after spending more than 2 decades in my field, I feel that India should have own database from which research can be conducted so that the local guideline can be modified to suit the Indian environment, because the temperature, climate, risk factors that we are going to discuss are all different in different countries and different climate. So you need local research, and to facilitate local research, we need a very good database. And unless you have database, you cannot do that. So this is the beginning point. So this has been functioning since last 5 years now. We have crossed 1800 cardiac arrest data already in the database. 5 hospitals of Gujarat and another 7 are about to join. So we expect by the end of this year, this should become the largest online platform where cardiac arrest data will be available, so that if you are interested at why do we think that more young people are dying or old people are dying, then rather than saying that what I believe, we should be able to talk based on data, the objective facts, rather than our personal beliefs and impressions. So to create that unbiased platform, because science and emotions, I always say that science and emotions do not go together well. So we have to keep the science as pious and as clean as possible without the so-called corruption in even data sciences. So to create that, we have created this platform, and I think we have just tied over our teething troubles, and the technical glitches are over. Now I think it should be smooth sailing.
That is very commendable, Dr. Anuj, and I wish you all the very best for this.
Thank you.
So, doctor, to begin with, can we get an understanding whether heart attack, cardiac arrest, and heart failure, are they the same? These names are usually used interchangeably. Can you clarify, is there a difference?
Oh, that in fact, I wish I could have told enough about this to my patients, that these 3 things are completely different entity, although as far as the etiology is concerned, they are related. So let me tell you, first step is say what is heart attack, what is cardiac arrest, and what is heart failure. Heart attack means when the blood supply to the heart reduces below a threshold level, then it felt the need. It is like a hungry heart crying for more food. That's the way you can understand. Heart attack is lack of blood supply below a critical threshold, after which it will start feeling the pinch. Say, for example, if I keep a human being hungry, after 1 day, he will not be able to go to job. So that is the first thing they do. Stop working, reduce the work. That is where when a heart stop working or reduce the work, it will not satisfy the demand of the body. Then you call it heart failure. That is, heart attack is lack of blood supply and reduction in function of heart. What heart is? Say, as we know that heart is a pump. It's a mechanical pump. It pumps the blood all across the body to maintain the circulation. When it cannot maintain the circulation to its expectation by the body organs, say for example, if I am 70 kilo, my body organs will require around 4.5 to 5 liter every minute. So blood flow, if it drops down below, say, critical threshold value of say 3 liter or 2.5 liter per minute, then if you don't provide forward flow, say just imagine a tube. If blood is not moving forward, it will pile up backwards, right?
Correct.
Because pump is not working. So whatever piles up backwards leads to flooding in the lung, because heart pumps the blood from right side. There are 4 chambers of heart. Right side 2 chambers receives the blood from the whole body and pumps it into lungs. From lungs, blood returns back to left side of the heart. Left atrium and left ventricle, they receive the oxygenated blood from the lung and then pumps back into the system. So when this pump derails because of any reason, the most common is heart attack. So let's link the 2 entities. Heart attack is lack of blood supply. That leads to chest pain, that leads to, and if heart attack is severe enough, say around when the 40% of heart do not get enough blood supply, that starts failing. That means, if I equate to my prior example, if a person is not allowed to eat for say 2 days, then third day he will not go to work. The same way, if 40% of heart is not getting blood, it will stop reducing its work. So blood will pile up in the lung, and that leads to fluid in the lung. Fluid in the lung leads to breathlessness, drop in oxygen supply, and that leads to further anxiety, increase in blood pressure, that will increase the stress on the heart, and that vicious cycle starts. So once that any patient enters into this vicious cycle, are more likely to die even before reaching to the hospital, and this will happen within minutes. So what we always insist, that whenever heart attack, I'm going to tell you the next what do and what you should not do. So heart failure is failure of a pump leading to lack of blood supply to the organs. That can lead to failure of the organs like drop in blood pressure, giddiness, fall, sudden loss of consciousness. And at extreme, if blood supply to the brain compromised beyond a limit, person may even collapse, become unconscious, and may die. If the heart attack is severe enough, it's around 60 to 80% of heart becomes lack of blood supply. It may stop. When the heart stops, we call it cardiac arrest. So on a spectrum, heart attack is the commonest cause of heart failure. If heart failure is bad enough to even compromise the survival, that leads to cessation of cardiac activity altogether. That is called cardiac arrest. So cardiac arrest, heart attack, heart failure are three different diagnoses. Let's not mix up all of them, and be very clear and critical when you talk to, especially we teach our subordinates or our doctor student, that please be very categorically what we mean, especially when you talk somebody on phone. If you're calling for dialing an ambulance, my dad has heart attack when my dad had cardiac arrest. No, don't mix up. Heart attack is chest pain, breathlessness, unable to lie down, commonest manifestation of heart failure. Cold extremities, we often neglect. These are the signs of lack of blood supply. It may start from as simple as dehydration, or it may have a lack of blood flow. Cold peripheries means lack of blood flow. Giddiness is the commonest manifestation of lack of blood flow. And cardiac arrest means person is unconscious, no blood flow, no blood pressure, and cold clammy periphery. So cardiac arrest is the extreme, and that means cardiac arrest means if person is not revived within 6 to 8 minutes, he's going to die. Right. So cardiac arrest is I would say, the terminal event of any severe disease.
Right. It's always amazing to be aware how our human body gives us so many alarms before it gives up. So if we listen to our body well, these issues can be averted. Is that a fair statement, Doctor?
Absolutely. In fact, I always say that what is medical science is a time-tested common sense. When I teach it, it's like that. More you know about it, you feel that how marvelous a machine Mother Nature has given us. In fact, initially I always kept on talking to Dr. Tural that we are the best mechanics in the world, because we are dealing with the most ingenious machine designed by Mother Nature, which is completely autonomous with inbuilt warning signs. It is we as a conscious person, we don't consciously perceive those warning signs, and that leads to this type of extreme diseases. So yes, we have to start listening from the inner.
Okay, so attack, then comes failure, arrest is terminal. Absolutely. I learned we still have few minutes to get to the right help, right?
Yes.
So friends, at some point of time in life, we have come across a sudden news of a friend or family member or someone who has been affected by a heart-related issue. At that point in time, a prompt action is required to save a life. And to deal with such a situation, we need to know the right information. And who better than Dr. Anuj to educate us about it? So let us dive into our next segment, the questions. We have gathered these questions from IV's members and our communities. For those of you who are watching this live, if you have a question, do send them here on the live chat below. We will try to accommodate as many questions as possible. And if we are unable to answer them during the program, we will get back to you after the program. We are prioritizing the questions that were received earlier. So, Dr. Anuj, our first question is on heart attack. Recently, the number of cases of heart attacks have increased, and many young people in their 20s, 30s, and 40s have died due to heart attack. What could be the cause? Also, do you think it is associated with COVID or because of vaccination?
I think it's a very, very valid and genuine topic you brought to the desk. First of all, I would tell you I would say a concept which is not perceived by the non-medical fraternity is this is called observer's bias. And I would not use the word thanks to COVID, but I would use the word due to unfortunate incidents of COVID pandemic. The whole world has become, has drawn attention towards health and healthcare issues. Healthcare issues has never found front page of newspaper so widely. So many doctors are invited to write editorials, and health concepts has reached to the newspapers. And because of that, people have started looking into it. In fact, we have perceived in India and developing countries that average age of heart attack is much lesser. And this is what being discussed in medical congresses or medical conferences more than 1.5 decades now. So first of all, heart attack in young age is not uncommon. It is now public know about it, non-medical fraternity know about it because of lot of attention healthcare issues received because of COVID. So first of all, it is not everything due to COVID. Due to COVID, the attention is drawn, number one. Second thing, because of the abnormal, so as you say that every coin has two sides. Development also leads to change in lifestyle. More development, more roads, more vehicles, less physical activity, that leads to more obesity. We call it sarcopenia. I think besides, people are now very well aware about that. Where is my weight is in ideal range, but hardly people know about that. Whatever is in my age, in my physical structure, is my fat and dry body weight proportions are equal or expected? No, we are sarcopenic. Our muscle mass is much lesser than desired, and that has led to the fat is metabolically relatively inactive tissue, and that really, in general, if you look at just stand at the gate of any school, you'll realize that more than 60 to 80% people coming out of the gate are obese or they are not fit. So a disease process which previously used to start beyond 25, 30 years, now it is starting at the age of 10 and 12. So obviously you will get its manifestation 10 years down the line, that is in mid 20s and 30s. So this is the way and obviously COVID, because it is happened in large proportions. So even if you have 0.1% of incidence rate as a complication of a disease, but if you have 1 lakh or 100,000 people suffering from disease, then obviously 0.1% or 0.01% also will become visible. So it is just a mathematical calculations rather than only COVID leading to this. Definitely COVID has affected this population because young people are more mobile, they go to society, they acquire more infections, and that's why they are more affected, and that's why percentage of it are dying. So it is not only COVID, it is lot of things are going around since so many years, I would say more than 1.5 to 2 decades, and COVID has added the final jolt. So it is not only COVID. Yes, COVID is leading to hypercoagulable states. Now the question about vaccine. If you read the good literature, now this is again a big question. What is good literature? We can actually have a complete discussion on it. What do you read in the newspaper? More than half or 2/3 of it are paid news. And I'm very sorry to say that what we read, let's understand the intentions behind it. So vaccine related thrombocytopenia and thrombosis incidence is much lesser than in average population. So vaccine leading to these things are, if you look at study population, if you do a study, then you find X number of people. But you should not forget that these are skewed data. You are actually studying those who are at higher risk. So who is going to take more vaccines? Those who are more at high risk. But now this is the first time in the history of medicine that such a large number of people got vaccinated. So even if you're 0.0001% incidence, you will find 10 cases across the world or 10 cases across the state. So that's how. So I would say proportion of it, and more as the time elapses, we'll come to know more about the long-term effects of COVID-related illness, or even vaccine-related issues. So is vaccine, say, immunity is a very complex topic. More we know about it, more we come to know that it's so complex that if anybody in the world says that, oh, I have understood immunity and the implications of it, he's lying. He's trying to put his own viewpoints and trying to fit his viewpoint into your brain to believe in such a way. So Lord, let's not get deviated into it. Fact is, what stands test of time is truth. That's the end result, I would say. So let the time tell, but it is an exaggerated fear, not stood in a test of statistical truth, that vaccine-related excess death is not a fact. Is COVID leading to a hypercoagulable state, leading to increased heart attacks in youngsters? Partly there is truth in it. But that happens with any disease. If a person has tuberculosis at this age, will also have more likely chance of dying, because it is a state of inflammation across the creates. So yes, if you have COVID, you should be doubly more careful before you start your exercise. That's the take-home message. You should take it.
Okay. So definitely we need to keep a check on that lifestyle. And friends, that is, you can safely say that the vaccinations may not be the cause of a heart attack. Um, it is basically the lifestyle, the food you eat, your obesity. All these are factors to take into consideration. Dr.
One more
Anuj,
fact, sorry to interrupt you. One more fact, as you just said, that COVID has restricted our mobility. All gyms has stopped. People going for a morning walk has stopped. I have so many patients. I would 80 to 90% of my patients, their daily routine of going for a morning walk and jog and gym, everything is disturbed. Why can't we talk about it? That also contributes to increased incidence of hypercholesterolemia and deconditioning and death. And this is not question of month. We have suffered almost for 2 years now. So very likely we are going to face the consequences of that as well.
so you can say it is interlinked also, right?
Absolutely.
We have the next question coming here. Doctor, if someone is complaining of a sudden chest pain, how do we know if it is due to heart attack or if it is because of another cause like acidity? What are the symptoms and signs that one should look for?
Okay. So I think one most fundamental stuff why a person gets heart attack is heart demand of the oxygen by the heart. If it is outstretched, it's a blood supply, they develop heart attack. So any chest pain which is occurring on exertion and get relieved by rest, more likely to be heart attack. Any chest pain which is, say, many people believe that heart is on the left side of the body, but just because its shape, heart is in medical terminology, heart is considered the midline tissue. Okay, so heart pain should be on midline, number one, not on the left side. It is a belief that if I have left-sided chest pain, that my chest pain is more likely because of heart attack, is a myth. Chest pain, say classical, if I want to just move it, people of heart attack will complain that I have something like this. When you describe the location of the pain or site of the pain by whole arm, more likely that it is heart attack. If you are describing your pain with a finger that I have here, pinpoint, that is unlikely to be chest pain because of heart. Second thing, if on exertion, sometimes you should pay attention to the what you call angina equivalence. That means heart attack like signs. People say that more than if elderly, female, and diabetics, these are the three groups which are very likely to have atypical features. That means after walking, you feel like acidity, a pain in the stomach after walking, which relieved by rest. Nothing to do with food intake. Something which comes up during jogging, especially jaw pain, ear pain, pain coming to your arms, can also be because of heart attack. So heart attack doesn't mean always the chest pain. Now, main question, how would you differentiate whether this is because of acidity or it is because of heart? One thing is clear, that if you drink, say, milk, antacids, take the proton pump inhibitor like either pantoprazole or aripiprazole or famotidine or ranitidine, the pain should go. And that should, now important thing is the time frame. If you drink antacid, the acidity pain should disappear within moment. Because it neutralizes acidity, the pain will reduce. But most important thing to differentiate is its relation to exercise, relation to exertion. Exertion may be as simple as going to toilet, do your daily activities. That's how we grade the chest pain, that it comes at what level of exertion. The lowest would be doing daily activities like changing clothes, like going to toilet. Then next step would be able to go out for like shopping. So that simple daily activities, if it is that, I would say that it is little less severe. Something which is coming only at the time of climbing stairs or doing jogging or doing your cardio workouts, then I would say that this is the mild form of, but something which mandates you to stop the exertion, always think that this is coming from heart. By and large, acidity would not have that correlation with the exertion. If any pain, may it be chest pain, may it be shoulder pain, may it be jaw pain, may it be throat pain, the classical description of heart attack is somebody has, if elephant is sitting on my chest, it is heaviness, not burning. So as far as doctor, we are taught very categorically, look at the character of pain. If it is burning, if it is eructations, more likely acidity. If it is no relation with exertion, acidity. Anything which is related to exertion, and there are overlapping syndromes. And that's, I would say, the beauty of modern medicine, that now we have all the gadgets to diagnose this thing within a moment, provided you reach to an appropriate hospital on time. So you should not neglect if this happening. So you may take antacid, but give yourself 5 to 7 minutes, 10 minutes. If then 10 minutes that pain doesn't subside, go to a nearby hospital, get an ECG done. That's the fastest. Most important, I would say that in the point of diagnostics. So I hope we have categorically made it clear that what is chest pain from heart attack, what is chest pain from acidity.
Got that, doctor. We have a question that has come from Kavita. She asks, do women show different signs and symptoms?
Especially atypical chest pains are more common in women. Now, let me tell you one thing, that women are by and large protected from coronary artery disease, or which leads to heart attack, as far as their reproductive age group. That means from menarche to menopause, because of the hormonal cycles, the incidence of heart attack, stroke is much less. So that means we call it pre-test probability. That means if I am given a patient with a chest pain who is middle-aged female, range 30s and 40s, with active reproductive life, then less likely that it is heart attack. As compared to male of the same age group, we will say more likely to cause heart attack. It is that gender difference is because of that hormonal cycle. So women are protected, but that does not mean that it is a license to not to have a healthy lifestyle. People feel that because we are women, because we have that hormonal cycle, it is okay to be obese, it is okay. No, don't misinterpret that. We have had female who have different type of diseases which are more common, like autoimmune phenomena, like vasculitis, like same hormonal when they are in excess, like in pregnancy, during delivery, after delivery, you take OC pills for regulating your menstrual bleeds or menstrual disorders. This all increases the risk of having heart attack or even stroke in female. So being female, you have one set of advantages, you have another set of disadvantages as well. So let's balance it out and then take it like it.
Okay, but I would say women, you are a stronger gender when it comes to heart health in your productive age.
No question about it. In fact, it is proven that even if you have emotional or social turmoil in the family, it is female who withstand it much better than so-called men who look and appear stronger physically, but emotionally female are more stronger. I must say that.
Okay, that comes from Dr. Anuj himself there.
No, it is proven. It is not say it's not my. It is there in the literature that emotionally female are much stronger, and obviously that is something hormonal milieu contributes.
So, we just had a question that has come in. If someone has sudden severe chest pain, what is the first aid required, or what must one immediately do at home before going to a hospital?
Excellent. First step, as I said, that heart attack is the discrepancy of let's supply to demand. So reduce the demand. What do you do it? Do not do any physical activity. Don't go for changing clothes. Oh, I want to prepare for going to hospital. I always keep on passing those harsh words. Change clothes if you survive. I pass a very strong message by giving this pause that in whatever decent clothing you are in, because changing clothes, getting out from bed, everything amounts to be additional load on the heart. Will you ask somebody to run a marathon when his one leg is broken? No. This is what you are trying to do when your heart is shouting for more blood. Then when you are getting up, going for loo, taking a bath, changing clothes, just because I want to go to a hospital, you climb down. I have few photographs in Mumbai. On one railway station, one guy developed chest pain because the first aid or the ambulance arrives on platform number 1. He was made to climb the flyover bridge. By the time he climbed that flyover bridge, he died on the flyover. So don't make this mistake. First step, stay wherever you are. Second thing, don't start that emotional turmoil cycle, because more emotionally you are disturbed, more likely your heart rate is going to increase. So request for help. Call your friend. If your spouse is around, let them dial a doctor or a nearby ambulance services. Never ever make a mistake of calling doctor at home. However, being a doctor, I'm telling you very point blank and front, don't call a doctor at home for chest pain, because he may be able to give you one injection of pantoprazole or ranitidine if he feels that this is possibly coming from that. But if you are doing ECG at home, then check the ECG. But by the time doctor comes to your hospital and do ECG and make a diagnosis of heart attack, it is anyway too late. And this is second thing. What as you just introduced me, and during introduction you told I am working on error prevention. These are, I call it 1 2 3 syndrome. What is 1 2 3? When first you call a doctor, doctor comes home, make a diagnosis, this is possibly heart attack, you go to a nursing home. When you do an ECG, find out that, oh, this is a heart attack, then you go to another hospital, number 2. So in that hospital, they said, oh, this is high elevation, echo is done, blood test is done. No, you need to fix up the heart by angiography. So you go to hospital number 3. We have seen large number of patients wasting such precious time, because I equate this phenomena with a fire. More longer you allow it to be there, it will burn your furniture. you need to quench it as soon as possible. How do you do it? By crisp diagnosis as soon as possible and get treatment on the spot. Many buildings, residential buildings, in fact, I have seen residential building with crores of rupees per flat, but none of them have a lift which can accommodate a stretcher. So my all builder community always says that you make a flat which is worth of, unless there are some flats now that they can accommodate car also in the lift. So barring those exceptions, very difficult. And what do? We will let the person walk into the lift, then go to the parking area, then make them sit on. This exertion can kill. So what you should do is let person, if say we don't keep a wheelchair at home unless your elderly person requires it. So what do it? Let that person sit in a chair, request 2-3 people to lift that chair. And if you have a revolving chair, make him sit on it and then revolve that chair into lift and to the car and minimize the exertion in short. And then go to a nearby hospital where cath lab facility is there. Heart attack treatment requires cath lab. You require blood pressure, or vital monitoring, ECG, blood test, echocardiography to diagnose it. Because this is something I call it railway station effect. Say you will see a train only when you are on the railway platform at that spot in time. So during heart attack, if you do the echocardiogram and ECG, it will be abnormal. But say, for example, you are at home, you take certain medicines, you take rest, then you come to hospital after 2 hours and the ECG and echo is normal. Does that rule out heart attack? This is the commonest mistake we do. We don't open the door when the train is standing on platform. Right? So please do the investigation on time. Otherwise, we have seen n number of people. They will go, oh, I told you, this is not heart attack. See, my ECG is normal, echo is normal. But you forget a fact that you try to prove what you want to. Because if I say that you have heart attack, no, you will give me a long lecture on my lifestyle and my food habits and etc. To avoid that, you keep on saying that this is not heart attack, my ECG is normal. No, you are trying to fool yourself. This is a catch. Remember the word railway station effect.
Okay. The viewers, remember, every second matters. And at any point you feel this is a heart attack or you are undergoing that pain, stop any physical activity immediately. It is really eye-opening how infrastructure and construction industries must take health and safety seriously and take into account every detail of saving lives. That is definitely eye-opening today. So, Dr. Anuj, we have someone ask us that is it okay to give Sorbitrate, which is the medicine that is kept under the tongue? And what about aspirin?
So these are two medications which people should, one way we can say that you should keep it at home in your first aid box. But be careful that these are the medication who degenerate over a period of time. So out of date, expiry date medication should not be used, number one. If you use aspirin, there are certain entry-coated aspirin. So ideally, aspirin should be chewed. Around 300-325 milligram aspirin should be chewed rather than swallowed because it gets absorbed from the buccal mucosa, provided. I would see the other side of coin, warnings. Those who are bleeding anyway, say for example, you're passing black color stool, you're anemic, you have red spots on your skin, if you're bleeding from the gums, if you have any reason for concern about bleeding, especially from intestine, you should refrain from taking aspirin or your aspirin allergy. So barring those conditions, during chest pain, if you believe that this is coming from heart, because if you take aspirin, because if your pain is from acidity, aspirin is going to aggravate it. So be careful about it. If your pain is because of acidity, aspirin can increase the acidity, can end up in aggravate the bleeding. But yes, when you are preparing to come to hospital, chew a baby aspirin that is around 75 or 81 milligram aspirin at home, and then start moving towards hospital. So what aspirin does, it reduces the platelet function because it is the cholesterol plaque which gets disrupted. Platelets take over it, and that makes a first step of clot formation in the coronaries. So the moment you give aspirin, the platelet adherence reduces, and that will prevent the heart attack from progressing. Second question about nitroglycerin or sorbitrate tablet. What is sorbitrate? It is the nitroglycerin. Nitroglycerin dilates the coronary arteries and thereby increases the flow preferentially. But because it is a vasodilator, it can, most common side effect is drop in blood pressure. So if you're having giddiness, if you are feeling nauseated, it's not a good idea to pop up sorbitrate. Sorbitrate should be kept underneath the tongue and chew. Rather than chewing it, just suck it up. And if you suck up, that most common side effect you encounter is headache. Just a minute. So if your headache is there, then lie down flat, elevate your leg. That will relieve the headache immediately, because that's the commonest side effect of sorbitrate. Those people who have low blood pressure, if you can measure blood pressure at home, if your upper blood pressure, that is systolic, if it is less than 100, don't take sorbitrate. So sorbitrate, so rest, aspirin, sorbitrate, start moving towards the hospital. These are the 4 things you should do at home. Now, one caveat, that don't lie down flat if you are breathless. If you are out of breath, if you cannot lie down flat, make them sit on a proper position the way we do it in hospitals. How you do it at home, make them sit in a chair rather than letting them lie down. Move them on chair. Provided breathless person, if you make them lie down, that will increase their work of breathing and that will increase their distress. Most important fact, if a person has heart attack and breathlessness, so 3 things you should take into account. 1, chest pain. Second, chest pain with breathlessness. And third thing, chest pain, breathlessness, and followed by loss of consciousness. First is heart attack, second is heart attack with heart failure, third is cardiac arrest. So matter is clear that if person has chest pain, no breathlessness, lie down flat, take aspirin, take sorbitrate, start moving to hospital. Do not change clothes unless you think that it is not decent enough to go out. That's fine. Even if you arrive in emergency department in night dress, is fine. No questions asked. Important fact is don't do any exertion. Take help. Nothing wrong in it. Take help of your family members, even if you have to change the clothes, or just put a top over jacket and come to hospital. Because people make this mistake. If you exert, you're going to harm your heart more. And that injured heart will really derail your whole life, because it is a fire causing a damage to your furniture. And here the furniture is your heart muscle. Okay, so sooner you act, sooner you quench that fire. And that's why reaching on time to the hospital. And that's why I would say that let's not talk all these big things. Do you know where to call an ambulance from? Do you know the response time of your government ambulance in your town? Please do it today. Do you know that because there is a law that if it's a more of a terms in common sense, that if you can, something can potentially go wrong, and it will go wrong when you don't want it. Your house apartment lift will not work on the same day. Your car will not start on the same day. You will be trapped in the traffic on the same day. Your doctor will be out of town on the same day, right? So be prepared for those contingencies and discuss it openly with your family member today. Don't leave it for that odd day. I would say that be prepared for that rainy day. That's the word is said. So discuss out. If I am 70-year-old, if I have risk factors, then this should be discussed optimally in your family gatherings. Actually, we always keep on refraining. So it's like we don't talk about death, but everybody knows that I'm going to die. So during our family meetings, this should be discussed, our preparedness. What do you do, beta, if I have heart attack? If dad asks this question once to his son and wife, the 50% problem will be over because the family is prepared. In the area where I live in, I know for sure that my response time, my ambulance is 23 to 28 minutes. What do I do for that 28 minutes? How do you get a person down from 12th floor apartment to a parking lot in a lying down position? Use your blankets. You can, I conduct first aid courses, and this is what I teach them, that how you get the person from home to parking lot to car, and from car to, and this is a real life demonstration because we have done it in real life, and you know for sure that this how long it takes. It takes a lot of time. Believe me, it takes a lot of time. Not in minutes. I have spent up to 45 minutes in reaching a hospital. So let's be prepared for it. It's not only the medicines, it's everything put together matters whether it can make a difference between life and death.
I totally agree. Friends, be aware, prepare, and know all this information around you, and that will definitely help prevent, which will help you save a life. We will definitely try and share such critical information as part of this episode with our viewers later. We have a question coming from Sharon asking, how safe is it to take aspirin since it is a blood thinner and many people have been prescribed to take aspirin on a daily basis? What are your thoughts on it, Doctor?
So aspirin should be taken mainly for the prophylaxis, prevention of heart attack. Who should take it? There are definite criteria for it. People who are obese, those who are at higher risk, especially who having family history of coronary artery disease or stroke, those who are diabetics, those who are hypertensive, obesity, high cholesterol. These are the group of people who are more likely to have heart attack or coronary artery disease related events. So these are the people who are prescribed aspirin. But who should not take it? Who has gastrointestinal bleed, lot of acidity, history of peptic ulcer, those who are allergic to aspirin, certain group of aspirin sensitive asthma. So they also develop increased incidence of asthmatic episodes if they have. But sometimes you have a patient who has all the risk factors and also having gastric ulcer or acidity problem. So what do we do with that? We have to prescribe another medicine. So as far as aspirin is concerned, take it only when your doctor prescribes it. Discuss it during your OPD visits very candidly about pros and cons of aspirin. Your doctor will be able to tell you that it is good for you, not good for you, indicated for you. Just because you read a lot about aspirin in newspaper, don't take it yourself. This is not an over-the-counter medication. You should take it. We have seen elderly people falling and bleeding heavily. Even slightest of the jolt in health with a blood thinner can lead to subdural hematoma. So it is not without risk. Yes, it is a blood thinner. When you take it in a small quantity, it is worked only as a blood thinner. Yes, we do take Disprin or a larger quantity aspirin. Important thing is everything is there in the dose. What is the difference between medicine and a poison? Dose, in which dose you take it. So if it is 85, 75, 81 milligram, it is low dose aspirin. If it is 350 or more than 300 milligram, it is intended to be work as a painkiller. If aspirin is taken in the doses of painkiller, is definitely going to cause acidity, can lead to peptic ulcers, GI bleed. So those matters. You don't keep on popping aspirin just for heart protection. Look at the dose, not more than 75, 81 milligram. In Western world, their tablet is in configuration of 81 milligram. In India and many of part of Asia, we have around 75 milligram tablets. There are then again a tablet which is enteric coated, which will less harm to stomach. But definitely any fire is going to heat up your utensil in whichever way we provide. So fire is fire. Aspirin is a drug. Take it as it is, not just like a food pill.
All right. So, friends out there, those of you taking aspirin or who's contemplating to even take an aspirin, please check with your doctor. And the dose is what is very important.
Indeed.
So, Doctor, our next question come here is ECG a reliable test for heart attack? What other investigations should be done? And where must such patients be taken?
ECG is very reliable, number one. Second thing, ECG is to be interpreted in context. Always take your old medical file. 2-3 important aspects about ECG I would like to draw to your notice. ECG is recorded on a thermal paper. If your old ECG is old enough, it will fade off to become blank. It is the dynamic changes in ECG that we look for as a doctor. When you reach to a hospital, staff nurse takes an ECG, we read up ECG, and often we ask, can I have your old medical file? We want to compare. What we want to look for, it are the dynamic ECG changes. So I'll just take back to you the same example, the railway station effect. That I'm standing on a railway station, you see the railway tracks when the train is not there. When the train arrives, you don't see that railway tracks. You see a train on it. And after train passes, again, you say the same railway track. So that means if your heart is at strength, if you see the ECG during that period, you will see a train on the track. The moment heart pain settles, by the time you have taken rest, you have taken aspirin, you have taken sorbitrate, and when you come to hospital, by that same half an hour has elapsed, ECG may become normal. So we always interpret the whole thing in context. So that means reach to the railway platform when the train is there. So if ECG is abnormal, if ECG is not say normal, reverted back to normal, we conduct certain tests. Say CPK, CPK-MB. This is creatine phosphokinase and its MB subgroup. So these are specific for diagnosis of heart attack. But mind well, this starts releasing in blood after 1.5 to 2 hours from heart attack. That means we will request, there is a protocol, all institutes have the protocol. When a patient with chest pain comes, you take ECG now, you draw the blood. You may do the cardiac enzymes, and then ideally you should repeat it after 3 to 6 hours. If troponin, CPK-MB have a timetable, I'm very categorical in it, timetable. That means after chest pain, it starts coming out of the heart. It reaches to a detectable level in 2-3 hours. It reaches to its peak level in 3 to 6 hours. So that means you have to repeat those tests. So don't be in a hurry. If you visited a chest pain clinic or an emergency department of any hospital, they will do blood test. They will do ECG. If ECG is abnormal, blood test is abnormal, they would want you to undergo something called an echocardiography. If echocardiography is the third modality by which we can say heart beats like this. Okay, consider that these are different walls and supplied by different blood vessels. If this wall moves.
Would you like to just take a pause and have a little bit of water because you're talking so passionately? I think you need a break and drink some
That's
water.
okay. Don't worry. So if your heart is pumping like this and suddenly it starts beating like this, that means this part is not moving. Can you see that?
Yes.
If that happens, that means this part is not getting blood. This is what we look at during echocardiography done in emergency department.
Okay.
So if any one of this sign, typical chest pain, ECG abnormality, abnormal blood test, or abnormality in the movement of heart. Right. If we find 2 out of these 4, we diagnose it as heart attack. So that means we do a battery. History taking, ECG, blood test. This blood test, say troponins are very sensitive, more than CPK-MB. But they come false positive if your kidney is not working properly. So every test has its own caveats. More I tell you, more I tend to be confused. So let's not go into that. You look at, these are 4 pillars of diagnosing heart attack. typical chest pain, abnormal ECG findings, abnormal blood test, and echocardiography. That's why always take your patient to a hospital where all these four are available. Because say if you go to a small nursing home and what they will do, they will not tell you no, but they will send the blood to an outsourced laboratory. So the turnaround time itself becomes so high. By that time, your heart attack will become from mild to severe. Then you rush to a bigger hospital where your ICU facility is there, and that 1, 2, 3 kills. So heart attack, whenever there is heart attack, go to a facility. So inquire today. Look at where you are staying. If you are staying in a village, have a very clear-cut mindset. It is just like you are signing a will that after my death, this bungalow will go to this brother and this son, and now this facility will go to the same way. Have a medical thoughts about it. That if I have chest pain, take me to this hospital through this route. My ambulance, do you know the response type of your ambulance services? So calculate all that and have a mind fixed. Determined family always take good actions in emergencies. So discuss it with your kids very candidly, which hospital you want to visit, by which route, who is going to call the ambulance in case of crisis, and where the ambulance is going to come from. If ambulance doesn't come, where do my car stands? How do I get the person down to your grounds? Everything, it's like you should just do a drill.
Okay, so this is, first of all, it's so interesting. We always just go in for tests without understanding the reason behind it. But thank you so much for explaining it in simple terms. And the other important part, viewers, is please do keep the address number of the multi-speciality hospital with you. We usually keep a lot of unnecessary things on our walls, but maybe it could be beneficial if you could keep all these details on your refrigerator, right? These tests are available at fully equipped multi-speciality hospitals. So please do choose such a known hospital in your locality, a hospital that can immediately cater to these needs. Since time is very precious in this situation, avoid going to a place that may not be fully equipped.